Welcome everyone to another episode here at Doctors of Podiatry. Today I'm going to not present a clinical case. Today I'm going to actually educate. As everyone has recently seen, we have and continue to post more on MIFAS, the acronym MIFAS. Let's look up here, please. MIFAS, minimally invasive foot and ankle surgery. And like I've said before, this is more, personally speaking, this is more of a philosophy, right? To be able to perform these intricate and delicate procedures through these tiny little keyhole incisions, less than a millimeter, is absolutely incredible. Yesterday we performed, and this is where I'm going to perform tell you guys about the case study. We performed a case on an 84-year-old gentleman from Uruguay who presented with, a couple of weeks ago, with pain on the bottom of his foot. And I will post eventually the pictures, but I'm giving you guys a little background. The patient, aside from being a healthy young 84-year-old, again presented with pain on the bottom of the foot. He presented with acute pain underneath the second metatarsal head on the ball of the foot. And part of the problem was that he presented with something that's called predislocation syndrome, which is also known as capsulitis, metatarsalgia. These are sort of the symptoms of the discomfort, right, that it can cause. So he came in here and we spoke for a long time about the causes, right? Capsulitis, metatarsalgia, pain. These are the symptoms. Going back to the causes, biomechanics, structure, foot structure, trauma, just to name a few, or simply getting younger. So the patient presented with a slight subtle dislocation of the second toe. And what I drew here is a schematic diagram so you guys understand what we did. Let's look first at the bottom, right? This is the actual clinical presentation. This is the metatarsal. This is the skin. This is the toe. So the patient presented with a lot of pain right here. The problem, and a lot of pain, that it was actually affecting his daily life activities, and he couldn't walk on his feet barefoot. So what was the problem? The problem is that the metatarsal and the toe, right, at the level of the metatarsal phalangeal joint, it had moved upwards a little bit, thus causing the metatarsal head to move down. But also part of the problem was that the patient did not have enough fat. And fat plays a really, really important role in the foot, especially on the bottom of the foot. So not only was there skin, you felt the bone, but there was no fat. So what I recommended to him at 84 years young was, why don't we do a little minimally invasive procedure to see if we can surely try to realign the metatarsal head with the base of this bone called the proximal phalanx, and bringing it back a little bit more into what we call the more anatomical position. And that's exactly what we did. After schematic diagram, we have the skin here. Now there's more space in between the metatarsal head and the skin, and the toe came down, right? And you guys will see it in the picture once I post everything. So he presented with a semi-rigid hammer toe deformity, pain on the bottom of the foot. We did the minimally invasive procedure, and this was the outcome. He did have a little, tiny little callus here, right? Just in this area. That did not bother him. So the saying and what we do is if it's not broke, we don't fix it. If it's not bothering the patient, we don't do anything about it. His problem was here, not here. So that's what we did. We focused our efforts on the problem. In addition to all of this, young patients who use high heels for a chronic or long periods of time, the fat, right, disappears. In people from all walks of life, the fat disappears. Whether it's a biomechanical problem, a structural problem, pre-dislocation syndrome, what we discussed, is very commonly seen. So I think this is a really, really great educational case because I know a lot of people have calluses on the bottom of their feet as a result of sometimes hammer toes. And hammer toes can actually lead to other problems. And one of those problems is exactly this: pain. And we have the good fortune of being able to perform these intricate procedures here in our office-based surgical suite to alleviate the pain, not having the patient have to go to the surgery center, right? We're not going to talk about premiums, high deductibles, patients paying out thousands and thousands of dollars to surgery centers or hospitals. Not only are we helping patients, we're saving money to patients. We're saving them money. So it's a win-win-win for all parties. And at the end of the day, the most important thing, outcomes. Number one at the top of the list. So I will stop here. I will definitely post the pictures so you guys can see the difference, and also post it on YouTube for all my YouTube viewers. And I think they'll be quite surprised to see a different side of me. Like always, www.jawspodiatry.com, Facebook, Jaws Podiatry, Instagram, Dr. Toe Jam, and lastly, YouTube.